We are Team 7, and we're doing our project on the Synchron Stentrode Neural Interface System.
I'm Kaylin McGeever.
I'm Nicole Adams.
And I'm Ayamide David.
So before we begin, do you have any ideas for what this technology could be used for? So what is this technology? This system is a brain-computer interface. The sensors are implanted in the blood vessels of the motor cortex of the brain. It then utilizes the brain waves and activity to control computers or external devices such as prosthetics. Eye movements are used in conjunction with the neuroprosthesis to give patients the ability to scroll, click, and type. Electrophysiological, magnetic, and metabolic signals can be used for recording. All BCIs use signal acquisition, feature extraction, feature translation, and device output to read and measure the results. Signal acquisition measures and amplifies the brainwave so that it can be detected and read by the software. Feature extraction differentiates signals from the brain that are wanted versus the ones that are unwanted. Feature translation takes the differentiated signals and programs them to result in a command. Finally, device output is where the device accurately responds to the signals and software, resulting in an output such as moving a cursor on a computer.
Now going into the potential impacts of the Stentrode device, we will be discussing who the technology is for and where it can be used. The Stentrode is currently being used for patients with amyotrophic lateral sclerosis, or ALS, which often progresses into locked-in state in which they are completely paralyzed but retain voluntary eye movement. Because the Stentrode replaces the need for physical motor function when using a computer for daily tasks by using the patient's eye movements and signals from the motor cortex, the population most likely to benefit from this technology are patients with upper limb paralysis, preserved motor cortex function, and control of eye movement. The Stentrode BCI is intended to be used in the patient's home following implantation and after patients have undergone training on how to navigate the technology. Once trained, patients should be able to type and click to control a computer and tailor their tasks for their own needs. As of now, there is potential for the device to be used for patients with other neurological or motor dysfunction, like patients with stroke, spinal cord injury, muscular dystrophy, and loss of limbs. We will later discuss other patients who could benefit from similar brain-computer interface technology. The creator of the Stentrode has said the main goal of the device is to improve independence for patients by allowing patients to complete their instrumental activities of daily living with minimal assistance. The device gives the patients the ability to scroll, click, and type on a computer. So far, patients have been able to use the Stentrode BCI for communication, financial management, and shopping. The training and function of the Stentrode can be personalized to the patient's needs and level of functioning through machine learning as the device is used regularly.
So currently the technology for ALS patients is quite limited, but so far they've alphabet and picture books, which are a bit inconvenient and difficult for people with motor issues. They also have some mobile apps that use picture words, emotions, and needs, and text-to-speech applications in order to better help ALS patients communicate with others. But again, for people who have some motor issues, this is a little bit difficult and tricky, as well as for those who are not able to use their voice, they're not able to utilize these apps. Also different variations of brain-machine interfaces, but Stentrode, Synchron Stentrode is a step further from these technologies and gives patients more independence and able to use their eye gaze to further help them with other different types of activities, especially for those who have impaired motor functions.
So for the financial impact, this is an illustration of the market value of BCIs from 2016 and then projected through 2027. As you can see, non-invasive BCIs are projected to almost triple in market value from 2016 to 2027. For the stock market and value, the market value in 2020 was estimated around 1.39 million. The revenue forecast for 2027 was estimated around 3.7 billion. and the compound annual growth rate, or CAGR, is estimated at an increase of 15% from 2020 to 2027. The invasive BCI, which is a surgical procedure that implants the electrodes directly on the brain, is expected to experience a large growth in the upcoming future as these BCIs have higher quality signals.
So the demand for this technology is pretty high, as ALS affects over 300,000 people worldwide and causes about 900,000 disability-adjusted life years, which is the combination of years of life lost due to premature mortality, in addition to years of healthy life lost due to disability. So this technology will provide a better quality of life for these patients as they are trying to gain independence, as well as communicate with others and just function as normal beings along with their neurodegenerative disease.
When implementing an emerging technology like the stentrode, there are challenges and other concerns that need to be considered, one of which is the training necessary for the patients to be able to use the device for everyday living. In early feasibility studies, training took place over 13 sessions within roughly 40 days. The training required for use of the device involves not only teaching the patient, but also training the device to detect neural signals and eye movements through machine learning and repetitive use. Another obstacle to implementation is the potential for device complications. The minimally invasive nature of the stentrode reduces some risks associated with implantation, but other risks remain, such as thrombosis, infection, and lead failure. Thrombosis and infection concerns can be addressed by prescribing anticoagulant medication and prophylactic antibiotics. The protection of the leads that detect the electrical signals needs further research, but we believe with the right precautions, the stentrode could certainly be clinically useful. The last major implementation concerns with the stentrode are security and HIPAA compliance. While the device itself does not contain patient health information, there is potential for future applications that will need to be secure and HIPAA compliant. In the next slide, we will discuss the use of BCIs for diagnosis, treatment, and remote monitoring of neurological disorders, in which encryption will be necessary to protect the patient's personal health information. As of now, Synchron has not released the extent of the security practices they plan to implement, but we believe that a secure network connection would be necessary for patients who receive a stentrode implant to protect any activity conducted using the BCI. Before we discuss the future outlook of the stentrode, what patients, besides those with ALS, do you think could benefit from this technology? The future for the stentrode and other BCIs like it is bright, as this technology has great potential for a wide variety of patient populations and uses outside of daily computer tasks. Though the stentrode is currently focused on improving patients' quality of life through the ability to complete tasks like shopping, communicating, and managing finances, other BCIs have demonstrated uses that could be applied to the stentrode. There is potential for the stentrode to be used to control mobility of prosthetic devices and wheelchair navigation. Additionally, Synchron is exploring opportunities for the stentrode to be used in neurorehabilitation, neuromodulation, and diagnosis of nervous system conditions. The wide variety of uses for BCIs creates new opportunities for patients with other conditions to use the stentrode. While other BCIs have been used for conditions such as depression and hypertension, Synchron hopes to use this technology in patients with Parkinson's disease, epilepsy, and brain injury. We predict that the stentrode will continue to make waves in the field of biotechnology and neuroscience as the technology develops further. And these are our references. Thank you.